Well, hello, I'm Dr. Valerie Walker, and today we're going to talk about a little subject that, a lot of y'all don't like to talk about, and we're talking about hemorrhoids. Those are the things you want to keep secret when you go in the store and you try to buy something from hemorrhoids. You're hoping that nobody's looking. You're trying to put it in the buggy, and then you're trying to hide other things under it because you don't want anybody to know that you have problems with hemorrhoids. But today, we're going to talk about them, and we're going to tell you ways to prevent hemorrhoids, keep them from coming back, and some out of the current treatments. So hope is on the way. All right, now, let me ask you a question. Has anybody ever called you a pain in the butt? And if they have, guess what? They just called you a hemorrhoid. Because a hemorrhoid is actually a pain in the butt. Now, sometimes hemorrhoids can be what we call internal. Sometimes they can be external. External, you can feel them. Internal, you cannot. And a lot of times people with hemorrhoids say they don't feel any pain at all. But the bulk of the folks, if you've had a bad case of hemorrhoids, you can feel them when you wipe, because sometimes they'll even bleed when you wipe, and they hurt and they are painful. And you the one sitting up in the meeting, all sitting to one side like this, because you don't want to sit straight up because it puts more pressure on the hemorrhoids and make them hurt worse. So what are hemorrhoids? A lot of people, I ask my patients, they say, oh, Dr. Walker, I think I got hemorrhoids. I said, what are they? A hemorrhoid, believe it or not, is a swollen vein. You know how you have arteries in the body? You have veins in the body, capillaries, all these types of things. A hemorrhoid is actually a vein. And a lot of people can't fathom that. A vein, Dr. Walker? I thought veins were just where they drew your blood from. Well, yeah, we draw your blood from a vein too. But a hemorrhoid is a vein, and it's a swollen vein, and it's usually located around the rectal, anal areas where we observe hemorrhoids. Now, who's at risk for hemorrhoids? So why do you get hemorrhoids? I remember when I was growing up, this is a horrible joke, and I'm not going to tell much of it because it's really kind of funny because I didn't know as a child. You know, you learn so much as a child that you don't know that you'll be able to apply it in your adulthood. But I remember when people got mad at you down south, and I'm from deep country in Georgia, they would always say, may the bloody powers torment you, may corns grow on your feet. And I'm going, what in the world is the bloody bowels? And I found out later they were calling the bloody bowels hemorrhoids, and that is a very uncomfortable thing to have. So when they told you that may the bloody bowels torment you and corns grow on your feet, they really told you something bad. Yeah, so that's not a good thing. So what are bowels? What are hemorrhoids? Like I said, they're just swollen veins at the bottom of the rectum. So they are veins, but who's at risk for getting these veins to swell up? And because they're okay as long as they're flat and just doing their job, is when they swell and can sometimes turn this thing called thrombotic and get really big and uncomfortable. What causes hemorrhoids? Let's go through some of the things that cause hemorrhoids, and then I'm going to tell you, as usual, always on these shows, things that you can do to help them with the recommendation of your physician. We always tell you to refer back to your doctor, tell them the things you've heard, and see what the things they want to do about it. Want to know, first risk of getting hemorrhoids is pregnancy. Most women who've been pregnant know that they can suffer hemorrhoids. It just goes with the territory. And a lot of times the treatment is getting rid of what's causing the hemorrhoids. And a lot of times with some therapy and a little treatment, not much, after the pregnancy is over, the hemorrhoids, they resolve. Another thing that can cause hemorrhoids is constipation. You know why? Because when you constipated, you straining at the stool. And you in there, I have people say they go in there for hours. If you haven't done nothing in hours in the bathroom, come out of there. Why are you sitting on the toilet for hours talking about you reading your best journal? You and your best journal need to come out of there. That's just too long to sit in there straining and pushing, because if it had not happened naturally, after 2 or 3 hours, it's not going to happen. I don't care how many journals you read, come out of there, okay? And wives or husbands, you see your spouse in there that long, run them out the bathroom. It's not going to happen, and you want to talk to your doctor while you staying so constipated. Other thing is prolonged diarrhea. Patients that have diarrhea that's just, oh no, I'm not talking about an episodic case of diarrhea, when you ate something bad and had diarrhea for one day. It's when the diarrhea usually go on and on and on, then you are subject to hemorrhoids. And remember, these are swollen veins at the anal rectal area. 45 years to 65 years and over, you are more prone to hemorrhoids. And this is a doozy, and this is one active research is going on that we haven't figured out. Did you know that wealthy people are more prone to hemorrhoids also? Yeah, so that's one thing we are looking into. We don't know exactly why, but wealthy people are more prone to hemorrhoids. If you've had colon cancer, and because colon cancer can sometimes mess the bowels up and all, you can also be prone to hemorrhoids, these swollen veins at the bottom of the rectum also. When your patient gets hemorrhoids, the first thing they do when they call me a lot of times, and they get concerned, because let me tell you something, what scares patients the worst. If I can't get you no other way, I can scare you with fear. Fear will drive a patient to the doctor's office. They will look back and say that they went to the bathroom and they saw a big toilet full of bright red blood. Oh, Dr. Walker, I'm dying. I see all this blood in the stool, and I know I'm checking out by tomorrow morning. A lot of times that can be hemorrhoids, because usually if it's bright red blood, it means it just happened. And what could just happen would be right around the anal or the rectal area. Now, sometimes if you're passing like dark red blood, black stools, that's not a good sign either. So all of these should be reported to your doctor. None of them really are a good sign, but get them checked out. But a lot of times if it's bright red and pretty, chances are it could be a hemorrhoid. But there again, you want to always call your doctor, tell them what you saw in the toilet. With me, you don't have to get so graphic. Oh, my patients, they call and they want to tell all the whole story. And I'm telling them, I get it. Trust me, I get this, okay? So talk to your doctor about it. The doctor's going to want to do a good physical on you. They're going to see when you had your last colonoscopy. Like I said, we're doing it younger now. We're doing it at 45 years of age. It used to be 50, but because we see colon cancer so much in younger people, we have boosted age up some, so down some, I'm sorry. So it's going to be 45 years old. Now, what are the treatments for hemorrhoids? Number one is you need to correct the underlying problem. I mean, you can't treat anything if you continually having constipation and diarrhea. You got to talk to your doctor again and find out what's the underlying cause of these hemorrhoids, and I can treat it. Pregnancy, usually they'll go away with some some cool sitz baths and all. They can go away when the pregnancy is over. You want to also eat a high fiber diet. Come up off all the junk food, all the cake and candy and pies and cookies and banana puddings and brownies and all those things that taste good. Like my best-selling book right here says, all the time, you all got to get a copy. It's humorous, but it's factual. If it tastes good, spit it out. So that's the way you roll with your diet. And you want to take daily sitz bath. Sometimes we have suppositories that can help. We also can do surgery if it's really, really bad. Sometimes you may need surgical intervention. So remember, hemorrhoids are swollen veins at the bottom of the rectum. There are a lot of things that can trigger them. There are a lot of things we can do to make them better. And the best is always going to go back to your lifestyle. Drink plenty of fluids. Try not to get constipated. Try to eat high fiber diets, like a lot of salad, things that are good for you. Try to exercise. Try to keep stress out of your life. This is Dr. Valerie Walker, and this was a medical moment talking to you about hemorrhoids and how to prevent them. Thank you.